It all kicked off in early 2005, and around about that time a lot of us were thinking about prevention. We were thinking about triangles. There were lots of triangles around, a way of describing the fact that, intensive care is needed, say, at the top of the triangle, and less care as you work your way down, and meeting the entire needs of a population. And the fact that if you're going to do that well, it needs to be targeted, so you can actually start getting to people earlier. And so we were talking through these issues, and I realised as a POP application came into view at that time, I thought that's our way into this, is that we've got this chance, an opportunity to use this extra money to create mechanisms that allow us to find those people, to match the services at the right level, and to really, in a strategic way, start shifting the balance of our care pattern.
My name is David Liley, and I'm the Programme Manager for Partnership Projects for Older People, Independence First in East Sussex. Independence First locally is a collection of about 12 to 14 different projects that have been running over a 2-year period. The Navigator service, well, it kind of is what it says on the tin. It's about helping people to navigate around this rather confusing world, especially when you're getting older, when there are lots of issues start to come up that weren't there before. And the Navigator service is there to try and help promote people maintaining their independence.
We're a one-stop shop. So we're giving people information, but we're going to their own home and giving them information. We're not doing financial assessments, so they're not scared that we're only going to help them if they've got enough money. So we can actually go in and people aren't scared about the information that they give us. So that it's adjusted to your height.
Someone arrived on the scene, Keisha arrived on the scene, and she spoke to me for a little while, walked around, met the dog, Nelson, and she had all these brilliant ideas of things that can help me around the house.
Yes, you could. Irene is somebody that we went to see earlier on in the year, and we've done all different kinds of things for her. We arranged for her to have Lifeline. We also arranged for the pension service to come and see her, who have given her attendance allowance, so that's increased her income. We've also arranged for little jobs around the house. There was a lock on a back door, there was a lock on a couple of gates. We've had some grab rails put in. Just little things to enable her to not worry about these things.
And they talk to you. How nice to have people that talk to you, because it can get lonely, it's amazing. With only a dog to chat to, you don't get much conversation from him. So they're marvellous.
But it's certainly true that we've got a raft of evidence about the success of the projects on every level, from quality of life and how older people describe their experience of the services, right through to economic benefits to everyone that contributed.
As a direct result of our work in POP, all of the primary care trusts, the major health provider trusts and adult social care are now more closely aligning the decision-making criteria they use for deciding on how to invest in services for the future. And that, for us, shows a real whole systems change, a change that will truly bring about sustained improvement in services.
Well, we wanted to recognise that older people, first of all, they're not a homogenous group. There's a very wide age range. They've got different ideas, different needs, different backgrounds. They also live a whole life. So if they have got health and social care needs, that's only part of their life. They've also got concerns about where they live, about housing, about transport, about what they do in their spare time. And we wanted to look at a strategy that encompassed everything that older people want to do. Getting people working together was quite tough at the beginning. Within the partnership are the whole range of partners within the council, plus our health partners, the PCT, plus people from the voluntary, the third sector organisations, and of course crucially older people themselves and carers. People are sometimes worried that if they start to ask people what they want, they'll come up with lots of things that we can't deliver on and it won't be a successful partnership. I think what you have to do is work with older people so that they understand the limits of what you can provide and what's possible and what isn't possible. And, you know, older people, just like everybody else, they understand about budgets, they understand about constraints on how people run services. But they also come up, I think, with very different and good ideas that we haven't thought of about ways of doing things that work better or maybe better value for money, more cost effective. our quality of life strategy is going to be very mainstream in helping us to work with people at an earlier stage in their lives before they perhaps need health and social care services.